am a student at Winston-Salem State University. I'm in the RN to BSN program there. Currently in Class 2501 Assessment for Health Alteration. Today I'm going to be performing a physical assessment on the lungs and thorax cavity. So today we have with us Tracy, but first before we get started we want to make sure that we have Mr. Tracy's consent to perform the assessment. Make sure that it's okay that we record him and upload the video to YouTube. So Mr. Tracy, do we have your consent to do all the following and upload to YouTube for educational purposes?
Yes.
Okay, thank you. So first we want to get started in the subjective questions. This will just give us a little bit of his medical background history and help us perform some of our assessment. So Mr. Tracy, have you been experiencing or are you experiencing any shortness of breath?
No.
Have you been having any pain on inhalation or exertion when breathing?
No.
Do you smoke?
No.
Okay. Have you smoked in the past?
Yes.
Okay. Just occasional leisure smoking?
Yes.
Okay. Have you had any respiratory infections?
No.
Have you been experiencing any coughing?
No.
Are you up to date on your immunizations as far as your flu and pneumonia vaccine?
Yes.
Okay. Are you current in your TB shot?
Yes.
Okay. And have you been exposed to any environmental exposures such as chemical factories or coal mining?
No.
Okay. So that concludes the question part of our physical assessment. Again, that just gives us a little general background of our patient. Next, we're going to move into and perform the exam, which entails the inspection, palpation, and percussion. We're first going to do the interior side of our patient, which is the front side, and then we're going to do the back side, which is called our posterior side. We're only going to do a little bit of the exam up front, but then we're going to do the full exam on the back, which is the posterior side. We just want to make sure that the patient is upright in the exam while we're performing. So first, as he's breathing, the patient, I just want to make sure that his chest is rising and falling. Just want to note his rate and rhythm of his breathing. I want to make sure that his chest is symmetrical, that both sides are rising and falling together on the right and left side, and that he's not using any of his accessory muscles. So just by looking at Mr. Tracy, I can tell that his breathing is within normal limits and everything looks good, and he doesn't look like he is using any accessory muscles to help with his breathing. 2, when you're doing your inspection, you want to note the color of his skin. Make sure that he's not pale, that he is just his normal color. 2, just want to make sure his positioning, he's not slumped over or his shoulders aren't up high, which would inform us that he is using other muscles to help with his breathing. Next, what we're going to do is we're going to auscultate the lung field, and this is just going to listen to his breath sounds. We just want to note any abnormal breathing, such as you could have bronchi, you could have diminished breath sounds at the bases of your lungs. Any of those abnormal breathing sounds you want to make sure that you note on auscultation. So first you want to start at the scapula of the lung fields, which is the top, and then you want to work your way down to the bottom of the lung fields. Make sure that you are noting all areas of the lungs. So Mr. Tracy, I'm just going to listen to your lungs if you would just breathe normal for me. And as he's breathing, you want to make sure that you're performing on one side that you're doing on the other, so the sides are corresponding. Okay, thank you, Mr. Tracy. And listening to his breath sounds, everything is normal in his breathing. I did not note any bronchi, crackles, anything that were abnormal. So Mr. Tracy, your lung field sounded great on auscultation. Next, we're going to move to the palpating of our inspection. But for this, what we're going to do is we're wanting to first start and palpate and just see on palpation if he is experiencing any pain, tenderness, want to check for lumps, and 2, want to check for any subcutaneous air. So I'm just going to start palpating Mr. Tracy, noting any tenderness. Any pain? Okay, and as performing that, I was making sure too that I wasn't feeling any subcutaneous air on the palpitation. 2, we're going to do the tactile fremitus, which is also known as your vocal fremitus. And what this is palpable vibrations felt through the chest wall. So what I'm going to have Mr. Tracy do is I'm going to use the ball of my hand for palpitation, and I'm going to move from one side to the next in correspondence, because you want to make sure that you're checking the left side as well as the right side. And when I'm doing that, every time I touch him, I want Mr. Tracy to say blue moon. And on some examinations, they can use 99, but for this assessment, we're going to use blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay, thank you, Mr. Tracy. All right, what we were doing there is every time he said blue moon, we were looking for vibrations that should feel the same on each side area to make sure that we're feeling those vibrations when he is saying blue moon. And we did. Got a little chuckled there, but he did great, so thank you, Mr. Tracy. What we're going to do is we're going to now palpate, look at the symmetric chest expansion, and what I'm going to do is I'm going to place my hands on the anterior wall, and then my thumbs at the costal margins. And what I'm going to do is when I do this, I'm going to have Mr. Tracy breathe in and out. And what I'm doing is making sure that I'm noting that my thumbs are apart symmetrically and noting smooth chest expansion when he's breathing in and out. So Mr. Tracy, I'm going to put my hands here. I'm going to have you breathe in and out for me, please. One more time, please. Thank you. What I noted there that my thumbs were moving apart symmetrically, and Mr. Tracy's breathing was symmetrical on the right and left side. So everything was within normal limits for that inspection. So for the next part of our segment, I'm going to have Mr. Tracy move to the side, and we're going to do the posterior wall, which I'm going to continue with my inspection, noting his chest as he's breathing, make sure that Mr. Tracy's sitting upright, that everything is rising and falling, that he's not using any accessory muscles for his breathing. And so the next part we're going to do is I'm going to palpate again on the back. And Mr. Tracy, if you'll let me know if you have any tenderness or pain. 2, as I'm palpating, I want to make sure noting if there's any lumps or subcutaneous air. Mr. Tracy, any pain or tenderness?
No.
Okay, great. So for that part of it, everything was great. Notice that Mr. Tracy's chest was rising and falling, and he wasn't having any difficulty breathing. Again, we are going to listen to the posterior side and listen for auscultation of the lung fields, just as we did on the anterior side. So Mr. Tracy, I'm going to listen if you could breathe in and out for me. I'm going to start at the top and work my way down. Again, when I'm doing this, I want to mimic one side that I'm doing to the other, going from right to left. And we want to make sure that we're noting any abnormal lung sounds, such as crackles, wheezing, diminished lung sounds at the bases of the lungs. Great. Thank you. And Mr. Tracy's lung sounds were normal, no abnormalities found on auscultation. So next we're going to do the tactile fremitus again, and this is again on the posterior side. And what I'm going to do is use the ball of my hand, and I'm going to move from one side to the other and have Mr. Tracy say blue moon, and listen for any the vibrations through the chest wall.
Blue moon. Blue moon. Blue moon. Blue moon.
Thank you, Mr. Tracy. So as Mr. Tracy was saying blue moon, I was listening for the vibrations through the chest wall, which I did. And so thank you, Mr. Tracy, for that part of our assessment. Next, we're going to move forward with the percussion. So what I'm going to do is I'm going to percuss in the inner spaces to make side-to-side comparison on the way down. So I'm going to start at the top and I'm going to work my way down, again going from one side to the other in correspondence and percussion. What I'm going to do is I'm going to make sure that it's resonance, which is a low-pitched, clear, hollow sound, which is noted in a healthy person. If it was anything other, we would listen for hyperresonance or dull, but hopefully everything sounds good. So what we're going to do is we're going to use my middle finger on one hand and I'm going to percuss. All right, thank you, Mr. Tracy. Everything was in with the normal limits. Again, it was what we're listening for is the resonance, which is again that low pitched, clear, hollow sound that's noted in those that are healthy, and lung sounds are good and clean and clear. Next, we're going to move forward with the diaphragmatic excursion, which I'm going to have, and I actually have to have a pen or pencil for this. And what we're going to do is I'm going to first have the patient exhale and hold, and what I'm going to do is percuss down the scapula and until the sound changes from resonant to dull. So I'm going to have Mr. Tracy exhale and hold. Okay. I'm going to mark on Mr. Tracy here where if you can let go of your breath, thank you, where I heard where it went from resonance to dull. And I made a mark at that spot, and what I'm going to do on the next one is I'm going to have Mr. Tracy, not just this moment, but I'm going to have him take a deep breath, and I'm going to have him hold it, and I'm going to percuss from where my line was down, and I'm going to mark where the sound changes again. So what I'm going to do is I'm going to mark again. Thank you, and you can let go of it. Thank you. And what I'm doing here is what I'm going to do, and I don't have a ruler. However, if we were to measure from the top line to the bottom where I had marked, that space would measure anywhere from 3 to 5, measures equally for the right and left side. And this is normal for a patient within normal limits. However, if it was abnormal, you would have a high level of dullness, which would state pleural effusion or atelectasis. So for the diaphragmatic excursion, that was within normal limits. So thank you, Mr. Tracy. Last of our assessment here today, we are going to do the voice sounds, which determines quality. And I'm actually, for this one, going to have the patient state 99. And what I'm going to do is listen, and when I listen to and hear, what I'm listening for is soft, muffled sound. If it was, the words are more distinct, then it shows consolidation and compression. So, Mr. Tracy, I'm going to have you say 99, please.
99, 99, 99, 99, 99, 99, 99, 99. So every time that Mr. Tracy stated 99 and I was auscultating his lungs, I could hear a soft, muffled sound. However, again, if the words were very distinct, that would show consolidation and compression. So that concludes our assessment of the lungs and thorax cavity. We want to thank you for joining in today, and thank you again, Mr. Tracy, for giving your consent on the assessment. And we hope everyone has a good day. Blue moon.